So, Dr. Michael Ryan with Missouri Vein Care answering the question, when is a vein condition a problem? And in my opinion, there are two areas that are affected in someone's health: physical health and also mental health with a vein condition. The physical health is really due to the progression of a vein condition, which is a circulation condition that results in your circulation slowing down and also associated with rising levels of inflammation byproducts in your body. The inflammation is a poison on your energy system in your body. And so people eventually get to the point where they're exhausted, usually in the evening. That's the worst time of day. And they end up sitting around and they just can't get going. And it's not that they don't have the will or the willpower or personal discipline. They are suffering from a flood of inflammation, uh, poisons in their body that prevents them from exercising and moving. And the result is that they gain weight. This is very predictable. This is the end of the line for vein condition. We see it again and again and again. That is very unhealthy. So before they get to that point, when they begin to slow down, that's really when you want to get a vein condition taken care of. And obviously, if it's there's a symptom that's bothering you even before you slow down, that's a good time to get treated as well. The other area that I see that is, I think, really important is the effect on mental health. And people do have a series of negative reactions to their vein condition. One spectrum is the individual that has been run down and feels exhausted and tired, and no one is able to tell them what their problem is. Their provider can't tell them. They just say you're getting old or just put up with it. I don't see anything wrong with you. And they're getting run down and tired, and they can see their health is going down. And they're maybe in their 50s or 40s. And I've heard different stories from people, including stories like, I'm going to, before I had treatments, I was putting in a handicapped ramp on my house because I thought I was going to be handicapped by the next year. Things like that. You hear stories like that. So people are feeling run down and exhausted, and they gain weight, and that is a tremendous health penalty on people. Uh, the psychological part, though, that really affects people is when they are exposing their legs, either the small spider veins, maybe a big patch of them, or ropey veins, or discoloration down in the calf, which is very common. and and people look at them, and people are naturally going to communicate in a nonverbal manner what they're feeling, and they may just be horrified at something that looks very unsightly, with a look of horror. They're aghast, they're shocked. They The expression that's conveyed to the individual who has the vein condition is, "Oh my God, there's something really wrong with you. There's something wrong with you." And what the person feels and experiences, I believe, is, and this is from talking to a number of patients, is they feel rejected, they feel ashamed, they feel that they're ostracized from the social community, because people are so horrified by this appearance that they almost don't want to be with them. They're like, "Oh my God, this is just horrible." And people feel that social isolation, and it is very deleterious to their psychological health, because people need to be part of a community, a group. The way they adapt to it very often is that they cover their legs up because they're ashamed. And shame is a terrible emotion for people to experience, because it's basically, I would paraphrase shame as this: I am so bad, I have to hide myself from people. I'm so bad. And that is not how people should be. People should feel free to move and act, and not have to cover themselves up. What is remarkable after treatment with people that have really unsightly veins, who are ashamed, and they tell me, "No, I haven't worn shorts or dresses in years, or 15 years or 5 years." After the treatments, they are transformed, and it's really remarkable, and one of the most satisfying things I experience as a physician, because they become a human being again that they used to be. They're happy, they're carefree, they move around, and really that it's not about being looking like a model. They want to look normal. They want to be accepted as a normal person, and that's what they get. And they are just tickle pink. So the two problem areas are the circulation affecting an individual's activity level, leading to weight gain, and the other is the negative psychology of feeling ashamed and also feeling that despair of nothing can be done to help me and being depressed. That's a very common reaction to a long-standing vein condition is the feeling that their health is just going downhill and there's nothing that can be done to improve things when in fact it's very simple and straightforward to do that. So Dr. Mike Ryan answering the question, what are the serious conditions that can develop with a vein condition?